So basically, this I want to focus on the technology for serum microRNA as biomarkers for endometrioid cancer of uterus and ovary versus endometriosis. So basically, endometriosis is a common benign disease which increases the risk of developing endometrioid histotypes, histological subtypes of ovarian and endometrial cancers. Therefore, early detection is very important for significant clinical outcomes. And considering on the common pathways, key processes which are common to both the benign disease and the carcinogenic or the oncogenic transformed disease, focusing on these and their specific genes involved, we can focus on the epigenetic modifiers, which are basically microRNAs. And so we hypothesize for that, considering them, if we can target them as non-invasive diagnostic biomarkers. So here, what we have done, we have taken out 10 of the three disease, 10 each sample patient samples, and versus control samples, which were of normal histopathological approach. And first of all, we have taken the biopsy, global microRNA expression profiling in the tissue biopsies. And from those outcomes, we have taken out or extracted out 8 microRNAs on which we have checked for their serum microRNA levels, so as to tell them as or define them as the biomarkers through ROC curve analysis, because by that we can check out for their sensitivity and specificity in the disease. And now, presently how the disease is being addressed right now, so it's actually a very central dogma of the gynecological healthcare, because endometriosis is usually it's hormonal dysfunction, but at the same time it has inflammatory etiology. Hormonal treatment has lots of side effect but little clinical efficacy, but anti-inflammatory treatment, it is like continuous, you can take on, and with lots of changes may occur later on. But hormonal dysfunction might not get altered. So because of that, the pathogenesis or the etiology will not change too much extent. So it remains central dogma of lots of gynecological disorders. And the only treatment left is surgical removal, followed by the histopathological based confirmation. But the disease may reoccur after 2 years or 5 years with the approximate 21% and 40 to 50% of that recurrence rate. And lastly, if the oncogenic transformation has occurred, only the chemotherapy and the radiation therapy are the options. So considering all these, we have thought of to consider those microRNAs because they are of epigenetic profiling. And if we were able to check them or validate them in the serum, which is a blood-based diagnostic test. So we have tried that, and here we were quite helpful in getting their association of these 3 diseases. Among these 8 of these, like 2, 3 were very much common, and one of them, MEET125A, was quite differentiating biomarker from the endometrioid carcinoma as compared to endometriosis. So considering these results or these outcomes, we can think of utilizing these towards designing affordable and reliable diagnostic kits, which can be used by the patient or the medical healthcare professionals, so that long procedure can be avoided, and simply non-invasive test can demarcate that the person might be having that particular disease, and the treatment may start earlier without having that oncogenic transformation and lots of burden on the patient and the healthcare system. So cost benefit analysis, if we talk about, so it's not a very much cost there, but we have to reach up to the 1 or the 2 microRNAs, because as I'm listing over here, there are approximate 8 microRNAs which we have targeted or focused on. But I think in the laboratory setting, 8 microRNAs per sample at real-time RT-PCR level is cost effective, but we have to lower them down to 1 or 2 so that we can make it out. And as the number of patients would increase by the testing, so they themselves will rule out which is the main, because in the less number of patient, definitely it's not very clear cut outcome ki which one to go. But as the number of patient or the number of testing would go up, so it will take out, or it will extract out the feasible one which can be taken further up. And currently, since it's a laboratory validation, so the technology readiness level is 4. For as far as IPER status is concerned, we are under process if we can get through. And it's a real-time RT-PCR array can be proposed for the present time in the patient serum samples to avoid the surgical procedures. And the market potential, if we consider, so all the patients or their, if somebody are having inheritable changes in their families, they can look for the and visiting gynae OPD for endometriosis or concerned cancers. They can be the mostly of use to them. Then hospitals, R&D companies, and diagnostic laboratories are major the target total addressable market. For the as far as channel or commercialization is concerned, R&D companies and diagnostic laboratories are of major through which we can go, because in the laboratory, in an institutional laboratory setting is not so appropriate to go for such large scale analysis. And yes, it has very high scale of feasibility because it will cut down the requirement of tissue biopsies or surgeries and will lessen the delays in cancer treatment. So it would offer a non-invasive diagnostic test. And yes, it would take, depending upon how much time we may take from a laboratory setting to a customized setting. We are under process with the some other agencies or companies so that we can, if we can set up some in the Punjab University, if we can set up some company can give us platform so that we can go for large scale analysis. So for that matter, funds, equipments, and manpower, whatever is the requirement, that will definitely cut down, because if some R&D company or diagnostic laboratory would come up, so they are already having those kind of manpower infrastructure, they must be having. So that can be cut up. Only the funds are the one which one need to put in. And joint research would definitely be better. As I said, the outcome from the large population will substantiate and urge the involvement of these microRNAs. So it would be a kind of joint research type, because technology is already there. MicroRNA expression is already there, but we have to utilize that technique for the welfare of patients. So my suggestion is for a joint research application. Thank you. Any questions?